Thank you all for being here today on this Sunday afternoon. I know many of you have come from far away. It's cold out there, and I really appreciate the turnout, and I think it's very important for all of us to know what our government can do for us. And I think this is a wonderful program, a wonderful opportunity for you to see what really happens in Austin. So I'm really proud to be here today, and I thank Erin and Bea and Emily. I don't know where she is today, but had a great couple of years working with these wonderful ladies at the Office of Public Insurance Counsel, and now I'm excited to work with them while I head up this exciting new program that I want to talk to you about. It's the Texas Consumer Health Assistance Program, Texas CHAP, that's what we call it here. And a little bit about the history of the program. The Texas Department of Insurance was given permission to apply for a grant from the federal government to establish this Consumer Health Assistance Program. We received the grant back in October. We received the funding for the grant. In December, we were fully staffed. We have a group of insurance specialists to answer your phone calls, research specialists, and outreach specialists. So approximately more than half of the states have this program. So it's a new office, and it's also a very important consumer protection because the law is very confusing and there's a lot of information. So that's why this office exists. We're under the Texas Department of Insurance. As you may know, there's multiple divisions within the agency. The Texas CHAP program is under consumer protection. And we're unique because we are funded by the U.S. Department of Health and Human Services. Well, who's confused about healthcare reform here? Okay. Yes. As you may know, based on media reports, there's over 2,000 pages of this law. And then when you add all the amendments and other stuff that passed, I think it's probably a 3,000-page document. So it's really complex. And that's why our office is here to help you. And you will learn about your rights under federal healthcare reform and state law, because there is some stuff that state law has that's even more consumer friendly and gives more protections than federal law. We will help you enroll in a health plan, including the pre-existing condition insurance plan, or PCIP. We're here to help you appeal a health plan's decision to deny coverage for treatment or service, and we can also resolve complaints against your health plan or insurer. Now, if you have a small business or know anybody who has a small business, you can learn more about the healthcare premium tax credit through our website, and we're also able to help you there too. Also, for those of you who don't know, and this is included in your conference packet, it's a program called Healthy Texas, and this is a state program. This was not a part of the federal healthcare reform. But this is a new state insurance option for small businesses. It serves small employers who have 2 to 50 employees who did not provide health insurance in the past. Here's a map of Texas's uninsured population. You can see that most of the uninsured are concentrated within these 5 regions. And Austin is one of these regions in the I-35 corridor. Our job at Texas CHAP is that we want to go and do 100 outreach events similar to this one by October and get the word out about this program, get consumers involved, go out into the medium of their choice, and to inform them about their rights and protections under the new federal health care reform law. And one of these provisions that's already in place is the pre-existing condition insurance plan. Texas is The blue states are the ones that the federal government is administering the plan, and Texas is one of them. And there's 3 ways to qualify for this health insurance plan. You have to be a U.S. citizen or in the country legally, 6 months without any coverage, and can't get insurance because of a pre-existing condition. And what it means is 6 months, no insurance means if you're in the health risk pool, the Texas state health risk pool, that counts. You can't have Medicaid, Medicare, or insurance through your employer or individual health coverage. You also need a pre-existing condition proof, and that's a denial of coverage. Now, a doctor's statement saying that you won't be able to get health insurance is not sufficient. You actually need a letter from an insurance agent or an insurance company dated within the last 6 months saying that you cannot receive insurance because of your condition. Or the other option is getting an exclusionary rider, basically saying that we will cover you for, if you have asthma, for example, the insurance company will cover you for everything except for asthma, and that is considered a rider. And if you're under 19, the offer of coverage has to be at a higher rate. Just put this slide in. It's extra detail of the 4 of the 3 points that I just placed in. Slide number 10. If you just want to make a note on it when you get my presentation. It's a little bit more details on how to qualify. The PCIP has 3 types of plans that you can enroll in, and they differ between premiums, deductibles, prescription deductibles, and copays. Now, there's standard option, extended option, and the health savings account eligible option. And most of them really vary based on the premium, the deductibles, your drug copays, your office copays. The first 2 plans, the standard option and the extended option, are more of your traditional insurance plans, whereas the HSA option is considered a qualified high deductible health plan for tax purposes. You have more control of how you use your health benefits. Here's what it costs you. If the premiums range anywhere from $174 a month all the way up to $749 per month, depending on your age and what options you choose. The features of the plan are they're pretty pretty standard. Offer pretty good coverage. Most of these coverages, a lot of it is 100% paid, no deductible. There's more information. I will be giving you a website where you can go to see more information about what all these plans cover. How to apply for PCIP. I have here the application for PCIP. It's only 5 pages long. It's probably one of the shortest applications I've ever seen for health insurance. Literally, this is it. 4 to 5 pages, a couple of questions here. This is how you apply for PCIP. Now, you could either mail an application, or fax an application, submit an application online. You can get the application through www.pcip.gov. You can call our number. We'll be happy to send an application to you. We can fax an application. We can help you fill out the application and enroll in PCIP also. Our number is 1-855 text CHAP. Or you can also work with an agent. Here's some figures about the enrollment in PCIP. As of November 2010, we've only had 393 Texans in the whole entire state enroll in PCIP. That is shockingly low. The program started in July, and this is how many people we have. And I'm sure, I don't know, the new numbers have not been released. I don't know I'm sure they're still not as high as what the current Texas health insurance pool enrollment is out of December 2010. And just to let you know, the rates for the Texas health insurance pool are 2 times the rate of the standard insurance rate, whereas PCIP right now, it's almost the standard, it's slightly less than the standard insurance rate. And in 2014, both of these pools expire, and the state does transition to an exchange. And Aaron's example of the exchange was fabulous. I have a scenario here for you. I'm going to read it, and then I'll ask you questions. Michael has been without insurance for the past 6 months. Although born in Maine, he currently lives in Houston. He's battling pancreatic cancer. Michael has been turned down by 3 insurance companies. He says that the state insurance pool is too expensive. Can he qualify for PCIP coverage? What do you think? Yes. Okay. And can you break it down for me? Like how do you? Okay, we know he's a U.S. citizen because he was born in Maine. He's been turned down. Most likely the pancreatic cancer was his pre-existing condition. And he's been without coverage for 6 months. Well, there's a lot of information. I just told you about www.pcip.gov. I know Aaron mentioned healthcare.gov. What TDI has done, and this website has been up for a couple years now, it's texashealthoptions.com. It's a very easy website for you all to remember, and it's been up and running for a couple years now. But lately we have modified it to include information about the Texas CHAP program and federal health care reform, and of course Healthy Texas. So depending on what your interests are, you can either go to the CHAP website, FHR, and over there you'll find everything that the department has done to implement federal health care reform, links to healthcare.gov. There's PCIP links through the CHAP website and the FHR website. And if you go to Healthy Texas, you'll find more information about that program and how to enroll and what carriers are offering coverage there. Also, on the left side of the page, depending on your profile, you can go ahead and select information, and it will take you to options, stating the profile that you have chosen. If on the CHAP website, we have some resources that we can offer you. We have federal health care reform fact sheets. Currently, there are 7 federal health care reform fact sheets that we've worked on. We have a couple more in the pipeline on various topics. We have publications. Included our flyer in your conference materials. We have this flyer in English, Spanish, Vietnamese, Chinese, and Korean. Depending on what's every flyer has English on one side and another language on the other side. We also have a barcode scanner. If you have a smartphone and you scan it, it goes directly to texashealthoptions.com. We're working on a question of the week. Last week was our first question of the week that's on our website. If you come to it more often, every week we're going to have an updated question of the week. There's information about the TDI Speakers Bureau. If you need to request a speaker or presentation on federal health care reform, that's where you can find information on. We're producing toolkits for caseworkers and clients. We're going to have information on our consumer focus group. Texas Impact is a member of our consumer focus group. And where have we been? We've been doing some outreach in various cities and counties in Texas, and all that information will be found on our Texas CHAP website. Well, my purpose here was to also inform you about all the stuff that's going on within the Texas Department of Insurance related to healthcare reform, but also to ask you a favor too. And what I would really like you to do is help me out here in spreading the message of Texas CHAP. And if you have a website that you can link to, please link to our website, www.texashealthoptions.com. Contact us for future outreach events. Request flyers if you know any areas in your community that would be interested in having our flyer. please let me know. Our fact sheets as well, if you know any groups that are interested in our fact sheets. And let us know about events in your community, town halls, other conferences, anything that you think that Texas CHAP would help and could help consumers. I'm going to end by some of our just our general resources. Our number is 1-855-TEXT-CHAP. Pretty easy to remember. We have our insurance specialists are ready to take your calls Monday through Friday. 8 a.m. to 5 p.m. If you leave a voicemail, if it's after hours and you leave a voicemail message, we will return your call within 24 hours. Any questions can be directed to the chap@tdi.state.tx.us address. I do have access to that email. I'm the one who receives those emails, so I will, if there's anything you need to talk to me about or anything based on this conference, email me there. And of course, our TexasHealthOptions.com.